Hi, everybody. This is your boy Trey, and I am back. I want to first of all say happy independence to all of you guys in the 242 and those who are also spending independence here in Toronto. I want to say happy independence to all of my 242 people out there. Thank you guys so much for tuning in. Sorry for the wait. It's always a delay with me, but I am here. um I'm gonna be basically touching based on the video that you guys had seen before, which would have been me going into surgery. Yes, a lot of people view my channel and figure that I was in surgery now. For you guys who are new to my channel, this is your boy Trey, and I am a trans man, and this is me. So I'm taking you guys through a journey on how I get to where I'm at now and what I was faced, whatever it was good, whatever it was bad, the complications. Like I say, I'm gonna give it to you guys straight 100. Best way I can give it to you guys. Um, in my last video, for you guys who has watched and those who have not, that will be part two. This is part three, where I'm basically because my top surgery was faced with a few complications at the beginning. First week was okay, and then as going into the second week, there goes was a few complications. But this is where I'm basically touching base with you guys on my surgery on to Montreal on my top surgery. On my way to Montreal, my surgery was great. Like I've told you guys in my last video, live video. Um, it went great. Like I said, I was faced with a few complications. I will show you guys that in my next video. I would give you guys a few photos on where my complication was, and it's gonna be not so good of seeing because like I said, my complications was based on a lot of buildup of fluid after getting my surgeries. I was not given drains because they didn't feel I needed them because I was small chested at that given point in time, which I eventually after a week start building up fluid. That would be my next clip, but like I tell you guys, I can't talk about what happened in surgery because I was actually underneath anesthesia. So that won't make any sense. I can give you a brief topic on what I faced on coming out of anesthesia. I was in a lot of pain, like you see in my first video. It was just that the anesthesia was wearing off. The pain medication that they were giving me was wearing off too, as well. So it was like almost like I sleep through the pain medication. So coming off of with the medication wearing off and coming off of the anesthesia and all of that was like a side effect where I was in pain. I felt nauseous, like I wanted to throw up. But there are a lot of persons that throw up after their surgeries. But um, apparently, I never did throw up, but I had that feeling like I wanted to throw up. That was the worst feeling because I felt it in my chest, I felt it in my core, and then it's like everything was just tight at that point in time, and I had a bandage going off, going around my chest. So like I said, I never looked at my chest until the next day when it was time to take off the bandage. But my whole journey in that hospital, going in, I was a little, scared because, like I said, I'm going into this room where there's machines, there are doctors, you're seeing everybody's like 20 to 30 persons inside this room that is gonna perform this surgery on me. So it's almost like it's like that fear before going underneath anesthesia. But other than that, you don't feel anything until waking up. As in any other surgery out there will basically go through the same type of experience. They'll go through the same pain in every different way that I went through. Like I say, some people were different. I've watched a lot of people on YouTube where their surgery, like in 2 weeks, they were perfect. Like, like I said, I'm to blame with some of my decisions and things that I make. That's why I would tell anybody, if the doctors has stated to do something, follow each and every step there is that they're saying do it, no matter how much your stress level might be or whatever you're going through. Just know that you're going into a surgery. This is a major surgery. Just follow everything that you're basically supposed to follow. That is key. Um, with my top surgery, coming out of it, I went into surgery. I was scheduled to come into surgery at 8 o'clock that morning, just to be there early to do the paperwork and the blood to make sure everything is set up correct for the surgery. But I did not go into surgery until like after 3 that afternoon, which I was supposed to be discharged after surgery, which would have been like a 2 hour to hour and a half surgery. So I should have been discharged afterwards, but like I said, I had a delay on my anesthesia because I decided that I wanted to sleep longer. But other than that, I was discharged. Well, I came out of surgery after, I would say after 5-ish, sometime somewhere around 5, and I did not leave until like after 9, almost 10 o'clock in the night. So it really all depends on how your recovery be, because they're not gonna discharge you from the hospital unless they feel as if you're safe to go home and everything is okay for you to go. Um, that's the key, and that's one thing that I admired about the hospital, because they, take everything in a by the book. I always say they follow the book by procedure to make sure that they don't make a mistake. So they were very good with that, and that's one thing that I like about them, was the fact that they were on point with everything. They knew what they was going to do. They was not going to start unless, sorry, they was not going to start unless everything was basically good. That was the good thing about it, and that's one thing that I admire so much about GRS Montreal. um Coming out, when I was discharged that night, I made a little clip. I think I had it in the last video. You guys can check that out. Make sure to continue to like, comment, and subscribe. And guys who are new to the YouTube, if you don't have a YouTube account, you have to make an account, email, password. Once you do that, um, afterwards you can subscribe. You only have to hit it once, not to every video, just one time. Once you tap that, there's a bell on the side of that. You can also hit that, and that will notify you when I have new videos. Like I say, I'm going to carry you through my top journey, and then I'm going to give you a little bit of the live life, on the day life, and different things that you guys will see on a day-to-day basis on the YouTube channel, not just my journey here. It's everything about me, and just to help someone out there and to keep everything positive and keep everything going. That's my whole motive and everything in this. Um, yeah, so back to my recovery. Well, coming out of surgery. When I was discharged that night, I went back to the hotel room where I was staying, where the hospital has provided for the patients to go that are staying on one night surgery. So I went there, and when I went there, I was able to walk out of the hospital, slowly, because you have stitches and all that different stuff like that. But when I got to the hotel, that's when my pain medicine started to like wear off. But I had to eat before I can do that. And when you're in so much pain, you don't want to eat. That's the problem. So I'm in so much pain, I did not want it to eat. So it was like a setback with me with that. I wanted the medication because of the amount of pain that I was in. I needed the medication. So most of my time, it was always a struggle for me to take the medication, because I'm not a big fan when it comes to taking medication. I hate pills. I will go the natural route, as natural as I can possibly go. Tug it out, deal with it. That's how I do it. But in this case, those medication, I needed like hell, like I was smoking. That's how I needed it. I needed it like I needed a high. So at that point in time with that, I didn't care. I just needed it. So I ate something like small or whatever with the that the hospital provide for me to do through the food menu or whatever. So I ordered something, and I ate a little small amount just to take the medication. It was always a fight to give it to me, because I don't like pills. So to know that I have to take it, I now have to fight myself to do this. I have to wear ice pack. Thanks a lot, Jess, for tuning in. Thanks for the support. Yes, you have to be strong out there for sure. And like I say, a lot of people go through different ways of recovery. My own was just not the easiest one, but it turned out to be a great results, which you guys would eventually get to see that. I'm working on that slowly in the gym, but you guys will get to see all of that. So just continue to stay tuned and just walk through my journey. You will learn a lot. And for those that got some questions out there of wanting to do surgeries out there in the future, like don't go off of what you see me. You can go off of a lot of people experience out there. You have persons that go into surgery recover quite fine. You have some that complications, there's some that has major complications. My own was not major. Mine was something that they could have fixed and automatically go into surgery again if I would have had to, but by the grace of God that always protected me, I walk out of there with just minor complications due to a buildup of fluid after a point of time. But everybody experience is different, so don't never be afraid. Follow your heart, be true to who you are. You know at the end of the day what you feel comfortable in, what skin. Me personally, I never felt completed unless I get my surgeries. I needed them. Like no matter how risky the surgeries might have been or whatever trauma I might have went through, I needed this surgery because I know that it would have complete who I am. And despite of who I was born to be a female, I am proud of who I am today. And it came a time when I could not even face an audience to talk. I did this journey. I've locked my way in from society for years just to go through this procedure to have a positive impact because everybody has some sorts of different point of view on the situation. Some will give you a negative point of view. Some will, friend you up and say that they got you and they don't got you. There's so many different ways that a situation can go. So as long as you can put yourself in a positive circle to go through the situation mentally, you will be just fine. I will say you'll be great. And like I say, you can go on with not only my channel but other channels. You can go out there and you can explore different people, like different people journey and how they went to it and different thing. But I'm gonna give you as natural as I can possibly do it. Like in so much different cases, like a surgery can be easy for you to walk in, but if you don't have that positive impact around you, it's going to be hard because you're setting your mind on all the negativity that is out there and forgetting the positive outcome or what it is that you have to do. So at the end of the day, you have to fight for what you want. At the end of the day, it doesn't matter what no one thinks, doesn't matter how nobody feels, how anybody looks at you. You can be your own enemy when it comes to yourself. So follow your own heart and just stay positive and things can go well. Um, Coming out of surgery, like I say, going home, it was a lot of pain. Going to the hotel room. But it was something came over me, like I was telling you guys, something came over me that I felt like something was wrong. And it wasn't that something was wrong with the surgery. It felt like something was pouring into my stomach. So I knew that it was something. And even though I was supposed to go back to Toronto the next day, I decided to stay overnight because I wanted to know exactly what was going on. And I knew that I had a live chat with one of the nurses that worked with my surgeon. So once she had called the next day after going through that, I finally drugged myself and put myself to sleep. um, that was the best part about it because going through those pain medications, like I say, if I could have refilled them numerous of times, it would have been an addiction because it's my experience. I can give it to you my way. A lot of people go through it differently. Um, the next day when I had my doctor appointment, it was like around 10 in the morning. They video called me because at the time of my surgery, it was like the start of the whole pandemic of the whole corona thing. So everything was like locked down. So my family could not come in. Nobody could have come in. I had to walk through the surgery by myself. Everybody, the furthest they could have go was at the door or at the parking lot and meet me outside when it was time to be discharged. That was the most scariest part about it because you had no one to look at you. When you come out of the surgery, you have to wait for the doctor. So that part, going inside there was, one of the hardest thing too, because you don't know if you're going to come out You don't know anything. You start thinking the most craziest things. And then I had my son with me, and to top it off, to know that he was crying and he was scared and different things like that. So to know that even though he was hurting and don't know what's going on or how the outcome would have been, him being there was like a push through my whole procedure. And I know that I needed to come out on top for him. So when I had my doctor appointment the next day on via call, I went inside the bathroom because this is the moment that I had to remove the bandage. So when I went inside there, this is like the first time that I'm gonna actually see how my chest looked. Now I know that I'm flat as a board because I'm looking at the bandage on me and I'm seeing that okay, I don't even have not a puck. So I was like, okay, I have to work on this. That's my own thing that I was thinking about. I have to work on this because I can't be flat chested like this. So I just wanted to know how my scars look because I've seen a lot of people's scars, and everybody had different sets of scars. They had double incision, some did a keyhole surgery where they basically just go through the nipple, and that's basically persons that has a smaller chest and does not have that excess skin. They can go basically the keyhole, but we don't get to make a choice. It's whatever the surgeon see is best for you. We can want that one and be like, you know what, I don't want the scar and I don't want this, I don't want to have to eventually get a tattoo. These are always the questions at the end of the day, and always the fear at the end of the day when it comes to persons, because they're afraid to get the surgeries because of the scarring or the pain, or the side effects, or if it can be any complications. This is a lot of things that a lot of people hit me up in my DM and basically was asking, oh, how was the surgery? They're afraid of it. They told me how brave I am for doing the surgery because they were fighting for a long time just to basically get on the list of getting it. And these are most persons inside the states that has to pay for these things out of pocket. And then you have over here where some persons it's covered by government. So it's like so much different ways. Some people have an opportunity to do it willingly. Some people have opportunity where they have their fundings and they can pay it. This surgery can range to $6,000 and up, depends on if it's Canadian dollars, US dollars. However, it can go up to $15,000. Depends on which one of the surgeries that they feel best fits you. But I was on the blessed side where it's actually covered, and thank God for that. I had the opportunity to make one of my dreams come true, to follow the rest of my dreams. Um, so when I had to go inside the restroom to start removing the bandages, I looked down at my chest, and the doctor, I didn't really I looked down to look at my chest as I remove it, but I was scared to look at it. So I had the laptop open at that present point of time, and then the nurse was looking. So as I was removing the bandage, she was like, "Okay, it looks nice, perfectly, everything looks good. How do you feel?" And I was like, "Okay, I feel good now that you say this is how it's supposed to look." And then she was like, "Have you looked at it?" I was like, "No, I haven't looked at it as yet." So when I did have the opportunity to look down at my chest, like I said, I was as flat as a 5-year-old chest. Yes, I was. Not anymore, gracefully. But um the stitch, I had a stitch from the arm, and I had it where I would have my pecs was formed. So I had like a little minor stitch here, and then they undertuck here, and they went from the arm, which they had to move the excess skin because when I had given birth to my son, my cups were much bigger. Anybody had kids will know that sometimes it grows, sometimes you lose it eventually. So and where I started working out, everything started to push downwards to form the male form chest. So anybody that did top surgery, but have not did top surgery, that works out in the gym, they know what I'm basically talking about because it forms the male chest, but the breast goes down. So that's how I started to look, which I hated it even more because it wasn't like the chest was going in, it just was pushing down. Um, so when I look at my chest, I knew that I had the chest that I want. I did not have to worry about wearing sports bra anymore. I didn't have to worry about wearing bandage, binders. I didn't have to worry about feeling uncomfortable. I felt like, I could go outside and just walk around topless. That's all I was concerned about. And now you can't stop me. Like when I'm in my house, I never have on a shirt. I've never have on a shirt when I'm in my house because I feel, I feel chill, I feel relaxed, I feel comfortable, I feel like, I am there. I'm like, you know, past where I was before. I'm like, I'm blessed. I'm happy with my decisions. Like, despite of whatever I went through, I'm like blessed with my decisions. When I saw my chest, I had a nipple grafting, where the breast was removed, and I basically they took the nipple off of my chest that was removed, and they build it back on, basically. So a grafting where they get a thin layer of your nipple and they graft it back onto your chest. So I had that type of surgery where I had end up getting incisions. I've also had the grafting also, where I had that, which you guys will see the complications with the grafting. Unfortunately, my grafting did not take, but I was able to catch the areola, but parts of the nipples was infected due to the buildup of the fluid that I had, which you guys will see in that video this week. Um, so, like I say, there's a lot of persons that have like that type of problem where the grafting doesn't take. It's not something that is not common. It is common in a lot of surgeries, because they're billing it, so not everything is guaranteed at the end of the day. You can only walk in there with faith. And faith is what I've always had when I walk inside there. And no matter what the outcome was at the end of the day, I was grateful because I had a plan B on what I would have done. In that case, like my surgeon has told me, a lot of people get tattoos where they draw the nipple, where they get a tattoo nipple on, where it looks so, but it's not there. So they have like this 3D type of tattooing or whatever. You can do that. Thank God I don't need that because my areolas had catch. That's in most cases when the areola doesn't hold. Most people go and do the tattoos, but I have my areolas. So that was never a big factor with me. My only fear in whole thing was when I started to see the buildup of the fluid. That was scary because anybody that has or had any surgeries that had fluids and had to get a drain eventually put in will know that area eventually turns swollen, it turns dark, it turns any type of way. It looked like it's bruised, and that's what I was looking at. So it came a point in time where I hated the way it looked, but I knew that after I talked to my surgeon was like, listen, this is minor. I'm telling you, if I gotta go sleepless nights, however, we're gonna fix this because he's never had a downfall when it comes to a surgery. He's actually one of the best in GRS Montreal, that I was given, and that I am grateful for. And he was the lucky guy to do all of my procedures. So I love my surgeon, and I thank him so much for making my life come true. Dr. Langani out there in GRS Montreal, he's the best. So if anybody out there that wants a surgeon that is recommended, I recommend GRS Montreal 100% full. And Dr. Langani, he is the best. He will make sure, ensure that you have what you want. And that's one thing that I admire about him. And he's a very nice guy. He's very great. He's very calm in every which way with the patients. And that's one thing that I admire with him. Sorry. Um, so with my showing my bandage, like I said earlier, I felt like something was wrong because it was like almost like something was pouring in my chest. But I figure that that's just how the stitch was supposed to be. That's what I'm gonna feel coming out of surgery because I've never had such big surgery on the chest. I've had surgeries before, but there were different things that I had surgeries for, but never so high in that area to know what that was supposed to feel like. And I was much smaller than this, so I would have bear more pain, I guess, being so flat chested and didn't have that much fatty tissues. So I worked out so much where there was no fat. Sorry, there was no fat to remove, but there were just the skin that they had to remove due to me being a bigger busted and losing it after working out and different stuff like that. So I advise anybody that is out there doing top surgery, like stay fit I'm telling you, it makes your surgery 10 times better, because if it's more things that they have to work with, it'll be more things and longer healing for you. Because the less fat and the less tissues in that area for them to work with, it'll be the quicker way that you will heal. Usually, bigger chest persons deal with more of the double incisions and different, like those type of surgery they would deal with, because it's more that they will have to remove. Um, yeah, so I had patches on my nipples to hold them, and then I had surgical tapes going across the stitches, to keep the stitches whole for about 2 weeks, when I would have get those tape removed from my family doctor here in Toronto. Um, so I stayed in Montreal for like a day after removing that. So everything started to be okay. Like I said, I only feel the pain or the surgery, the stitches from the surgery, when that pain medication wear off. And that's anybody that goes to a surgery. Anybody that goes to a surgery or has any wounded places or any areas that has a cut or anything on it, basically they're gonna feel that pain if they're human. So yeah, that wasn't a big factor. As long as I had my meds and everything going, I was up and running like the next day, like less than 2 days. I was up and running. I went to the mall. I went driving. I was good, you know. So like I say, I stayed over there a day after, just to make sure that nothing would have happened throughout the night. I've talked to my surgeon. I've been talking to them throughout the whole night. They make sure I keep intact with you no matter what time of the night is. If I was in surgery right now and I was discharged and had to come home, if I had to call them now, they was on it. They would tell me what to do, how to do it. Even if I had to drive out there, that's how quick they on it. And that's one thing I appreciate with Montreal. Um, yeah, so when I came home, it was the 7th of November 2020 when I came back from Montreal after having my surgery on the 4th of November. I came back on the 6th. I think it was the 6th or the 7th, if I'm wrong, but it can't be no later than that. And when I came back, everything was great. But then I noticed when I went to sleep the night after, I noticed that my left side started to swell up. And I was like, no, this is not normal. Usually, if it's swollen, it look a certain way, but why is it that one side is bigger? And it was always this area right here that was the biggest, and this side was flatter. So I was like, no, it's impossible for one side of my packs to be bigger than the other, because it did not look like that when I left. So I knew that it was either I moved too much or it was either irritated. I knew it was swollen. So I did not really panic that much or whatever about the situation. I just kept going. I took my meds. I lay down. I took some rest. I had my ice pack on it, like consistent, because they would tell you ice it as much as you can keep it to keep the swelling down. So you always have to have ice on your chest. Like you guys have seen in that video, I had two ice packs that I got from the hospital, which I had to keep putting ice inside there to keep it going. I advise anybody when they have top surgery to make sure to always ice. Well, like they say, consistency, like be on it with the ice in, because it helps with the swelling. I can tell you it really helps with the swelling. So yes, when I saw that, I continued to ice, and I noticed that no matter how much I iced it, it was swollen. So I contacted my doctor right away, via email, because like I say, it was in the pandemic time, which we are still in, but it was at the earliest stages. So with that whole thing happening, I called my doctor. My doctor was like, okay, monitor it. And then they sent me a referral to see a specialist here to do some ultrasounds and x-rays to see if it was a fluid build up, sorry, anywhere in the area, and if I needs to come back to put the drain in, because it has to be a certain amount of fluid before they can put a drain, because you can eventually, the fluid will come out through the antibiotics. You can pass it out, or you can basically have to build up where they need to install the drains. So at that point in time, when I took my x-rays and ultrasound, I had a buildup of fluid on my left side, and I had a small pocket on my right side, which they didn't feel it was major, which it wasn't major because it was not the amount of fluid built up to install a drain. Like he said, it would have never made any sense because nothing would have went into the drain. But gradually, after a day or two later, that got bigger and it moved from the left to the right, and it started getting dark. So at that point in time, he was like, "Okay, see the family doctor before coming out Montreal, because to come from Toronto to Montreal is like they would not advise you to come back and forth like that because it's a long way. It's like a 5.5 hour drive. Some persons fly, some persons use the transit. There's many different ways of getting to Montreal, but the driveway because I like to explore. I like to see things. I like to feel like I went somewhere. So I took the drive. And when I did my x-ray and different things like that, after telling the doctor the percentage of the fluid in there, and I went to my family doctor the next day and she saw it and she was like, okay, I think that we need to install a drain, or even if we don't install a drain, we need to move some of the fluid. At that point in time, I had a choice if I would let my family doctor do it or I would go back to Montreal. I choose to go back to Montreal because I have strong faith in my doctor and I knew that he would have done everything that he can possibly do. So I decided to drive back to Montreal the next day, which they asked me to come to Montreal. That was like a week post after having surgery. So when I went back to Montreal, I saw my doctor right away. As soon as I went in there, he came in there and he was standing there and he was looking at my chest and he was like, I can't see where we went wrong. We didn't go wrong. I know that for sure. Like everything is good, but why is the build up? And different stuff like that. And right away he went in there and he used a syringe, a much bigger one that I do my injection with, and he it's installed it in through one of the stitch and he removed some of the fluid out of it. So when he removed that out, I'm looking at this drain because I cannot feel that area at that present point in time because it's numb, it's swollen. It's like you're not feeling anything in that present point of time. So when he removed, when he had put that in there and removed the fluid out, I'm looking at it. It was like one and a half of the syringe that he took up, and it was like this thick, and it was about that long, and he was just pulling it out, and I'm looking, and it went down like so. We automatically knew it was fluid, and he was like, "Okay, it's out. It should not build up." I was gracefully that I didn't have to put the drain at that point in time, and everything was fine. He ran some tests, everything looked good. Everything, the stitching, the nipple grafting, everything was great and everything. So, he cleaned me up and different stuff. And I went back down Montreal, Toronto the same day. I just drive out for that day and I drive back down or whatever. And, gradually after time, I had another delay where the fluid eventually, where he had removed the fluid on the left side, that went perfectly back to where it was supposed to be. But the small amount of fluid what was in the right side that was not enough fluid for them to pull out the fluid. So that eventually turned into a bigger pocket. So it's like the fluid was moving from the left side to the right side. It was like my body had its own mind. That's how I should say. It had its own mind. It was doing its own thing. And so at that present point in time, I'm getting nervous and different things, all that. But I knew that it was just a buildup of fluid. It was nothing where I would have died or need to be hospitalized or emergency go back into surgery and different. I knew that it was not that big of a complication. So that made me even comfortable and even greater. And to know that my surgeons and everybody was on it, that made me even greater and comfortable. And like I tell you guys, this is my experience, and you guys will get to see the wonderful outcome of it all. So you will see the good, you will see the recovery of the good, of the bad, and then you will see the recovery of the finishing the topic. Sorry, you will see it. You will see it all. So at the end of the day, I'm gonna give it to you, however you like it, however I can put it out there. um like you guys have seen in the video there, you would have saw the white strips and then you would have saw the nipple patch inside there. Those things was removed after the fluid build up. So when they were removed, the fluid started to build up so much where it started to come to the right nipple. So at that point in time, I went back to Montreal. Like, my doctor asked me how soon could I come to Montreal so they can check it out because they don't understand it. And like I said, I made a decision to continue dealing with Montreal than to have two different doctors dealing with a surgery that they didn't do. So I prefer to go where my surgery was taking place. So I didn't have any problem going back to Montreal. Whether if they just say in the middle of the night or early in the morning, I was going out there. So I most definitely went out there. And so this is my second time, which you guys gonna see that also. This is my second time that I basically went to Montreal to see what was going on with the fluid buildup. At this point in time, both of the nipples has been infected due to the fluid. The fluid had came through the nipple grafting, so that had given a minor infection where I had to go on antibiotics and different stuff to make sure that area is clean. So every day I had to now clean that area and different stuff. So me now being in Montreal for the second time, a drain was installed then. So I had one drain installed on my left side. Is it my left? Yeah, I think yes. I had it installed on my left side where I had to now do self-care on my own. So which you guys would eventually see the length of that drain that had to go through the stitch, and I had to wear this little, it had to be hooked on to my pants or my underwear and different stuff like that. So at that point in time, I didn't want to go anywhere because I'm not walking around with a drain with fluid inside a bag and anybody looking at me weird. So I basically stayed home for that time until there was no more fluid going into the drain. At that point in time, I eventually started to lose a part of my grafting. So that was like a sad part for me because I did not want it to go through all of that, but I knew that that would have been one of the outcomes of having the infection in your chest after having the fluid build up. So I knew that it was a possibility. So I was okay because, like I said, I have already paced myself for a plan B just in case something would have happened. I would have known what I would have done. So I had a choice to either wait a year to go back into surgery to build that in after it's healed and different stuff like that, or I can do the tattooing if I wanted to. But surprisingly, when I went back to do my year follow up with my doctor, the grafting had taken eventually. It did. So I started to build the area of the nipple that I thought I had lost. But some part of it was lost, like I've stated before, but it wasn't lost where it don't look like a chest or it doesn't look like a nipple. Everything has formed the way that I wanted it to basically look at the end of it. It was a great outcome. So that all matters at the end of the day. So it was like two times I had to go Montreal. The second time I went Montreal, actually the third time I went Montreal, I had to get the drain installed. And then my last time was like when I got the perfect okay that my chest was actually perfect. Everything was great. Everything turned out well after dealing with it for like, I would say like a month. So it's like a week after a week dealing with the fluid and different stuff like that. So after a month time, my chest started to look good. So I was at the time where I was actually massaging the areas to keep the areas so the swelling and the bruised tissues and everything can start going on, because after you have tough surgery and different things, you have to now massage those areas so you can now gain back your feeling. Some people loses their feeling, some people still keep the feeling in it, some people have slight feeling in their chest but not all of it. So it really all depends. With me, at first I could not feel it. Like I said, I had the infection. At first, I could not feel it, but gradually, as I heal, I started to gain my sensation back and everything. So your boy got sensation in his chest. I can feel. So a lot of myths out there saying that you lose sensation, you will never gain it back. Listen, it's not true. You will gain it. Everybody has their own ways of dealing with situation, or their own recovery, their there's all different ways. So don't just go on the first thing that you see, because Same thing they say with bottom surgery. Like the only thing there is with these surgeries is a lot of people that has problem with the scarring, which you can eventually cover. Because I saw a lot of people use tattoos to cover up a bruise or something out there. So it's the same difference, you know. Bottom surgery was a little bit harder because it's there's a lot that you'll go through. It's like a 10 to 11 hour surgery for just the one, and that's not the other two after. So it really depends on, you know, what it is that you're gonna deal with. Um, but yes, that was my journey of my top surgery. Coming out of my top surgery, um, I had the complications 2 weeks after of my top surgery. But like I said, it wasn't something drastic where I had to go, you know, emergency rush inside there. They have to go back into the wound and no, it was perfectly just a buildup of fluid and a minor infection, what caused by the fluid buildup and different things like that. Like I say, self care is something that you will have to most definitely do if you're doing it by yourself. Also, you will have to most definitely be very careful in those areas and do everything that is given to you. I had to come and I had to do massage. I had to massage the area. I had to continue to pack. I had to use binder. I had to strap down at least for like 2 months. I had to still wear a binder. I could not work out. That was the sad truth because I love to work out. So to know that I could not work out until like 6 to 8 months after my surgery or until the surgeon approved, I had to stop working out at the gym for like that period of time. But I was able to, where I was moving so fast after the fluid started to get better, everything was just moving so fast and healing after that and different things. I started doing like little minor workout and different things like that. So that all helps out quicker, you know. So I was like my own therapy to my own self at the end of the day. When I shower, I will massage the area. I would keep it like keep rubbing it in every which way. And my stitches was awesome because as I gradually work out, my stitches like it was disappearing. Like most of them disappear. So it's like little portions of whatever you will see, but like I said, you guys are gonna see that. You're not gonna see it in a photo. You're gonna see it in actual live. Like I said, I'm gonna give it to you natural. I'm not gonna give it to you in a photo. Photo can be cropped and added. I'm gonna give it to you naturally. But not in this clip, unfortunately. But as I do my videos, I do photo, I do live. I'm gonna give a little bit more. You're gonna see a little bit more inside these videos as they come in. It's gonna give you more. I'm gonna walk you through my journey here and how I get so handsome, you know. So I'm gonna walk you through that step by step through my journey and to let you know, don't be afraid out there. You know, take risks. Life is risk. Every day we go out there in the world, we take a risk. When we jump on a bus, whether we drive a car, whether we go to work, whether we go to school, no matter where we go out there in life, we have to take a risk. We taking a stand out there. So don't be afraid to go out there and take risk out there. Just be strong, keep the faith and keep that positivity around you. Then you can lose. You have already won. Once that time comes, you have already won. For you guys that will be watching this that is new, please go to my channel. I see a lot of people are adding me through Facebook and adding me through Facebook. Basically, there's no problem with sending the friend requests. I love meeting new people. That is awesome. Also, show some interest and some love for your boy out there, Trey, and YouTube. I have my YouTube channel. All my links are posted before I come on live. Check them out. There are different stages. Every video I am posting, this not me now. There are all videos that I have went through before in my procedures, my journeys, my surgeries, everything that I've went through. They're all new. They're all old videos that are now bringing you up to where I'm at now. I would like to give thanks for everybody that out there that shows some mad love out there on my page. Like I said, they had hit up my YouTube page like crazy, showing some mad love. My Facebook is going off. My Instagram is going off. My TikTok is going off. Everything is going off. They are showing some mad love out there. Thank you guys so much. Once again, I want to say happy independence to all of my people out there in the 242. I want to give thanks for the UK, Maryland, Jamaica, the Bahamas, Canada, number one ranking. I have France now joining in YouTube. I have Mississippi. I have DC. I can go on and different things of persons that are hit me up. A lot of people were inspired by my video. Thank you so much for showing some mad love. I'm glad that I can help you guys. A lot of persons hit me up also and say they are afraid to do their surgeries and they are inspired. Listen, don't be afraid. I decided to give it to you guys this way because when you go on the internet, when I had to go on the internet and search things to get my own experience on my situation, on my surgeries, it was almost like I'm hearing that, you're not going to get this, and then I'm hearing you're going to get this. So at the end of the day, I had to put those two things together and make a decision of my own. So not everything that you see on the internet is going to go, because I thought in 6 months I would have been full of hair on my face and deep voice and down built like a bodybuilder. But 6 months, I've only had about 2 or 3 strands under my chin, and my voice hardly didn't even crack. So a lot of people are different when it comes to this whole hormones. Different people are on levels, different levels. I'm on 0.90 now, so I'm almost at 1 ml, which I'm hoping to do that by next month. I'm basically almost 4 years in my transition. Yeah, so this is your boy Trey. I'm a FTM. I was born a female and I am now a male. For those who know me and did not know me, or those who know me before, my birth name was Tyvania, but I'm proud to say my legal name is Trey. This is as real as you're gonna get it. I'm bringing it to you as natural as you can get it. I love you guys, and listen, make sure to show some mad love out there. Some mad love. Thank you so much, all of you guys who tuned in, and for those who will be watching later. Thank you so much for showing some love. Thanks for hitting up your boy Facebook page. Thank you guys for showing some love on my Instagram page, my Twitter, and my TikTok. Thank you so much. Make sure to always tune in. Make sure to share this link. Share this. Share this. I'm telling you, share this. Share this link. Subscribe. Show some love. Comment. This is your boy Trey. I love you guys. Happy Independence 242. I'm in the 6. Peace. I love you guys.